Hello, everyone. Welcome to episode 10 of White Knuckling Through Life. We shared with you in our last episode a stroke survivor who demonstrated a journey of resiliency, but with some challenges and some hardships that I can't, I've never experienced. So it was interesting to get her perspective, and we like to have solutions. So we have somebody that we will bring on in a minute, but Diann is going to introduce our next guest. And I'm very excited about this because I feel like I'm going to learn a lot today as well. So Diann, why don't you take it away?
Yeah, I'm really excited too, Leslie, because everything we do, everybody reacts differently. And so today we're going to find out, why are some people more resilient than others? I was really fortunate to have met Anneka at one of my events from work. And, just hearing what she had to talk about was like, you know what? This is such a broad subject that you don't have to be in the workers' comp arena to be able to appreciate it. So our guest today is Anneka Hofschneider, and she is a nurse. Anneka, can you tell us a little bit about your specialty and what you do?
Hi, well, thank you so much, both of you, for having me on. I'm really, really excited, and I'm sort of now a fangirl from watching a couple of your episodes. So I'm Anneka Hofschneider. I'm the Director of Behavior Programming at Center for Neuroskills in Bakersfield, California. My background, my specialty is in applied behavior analysis. So I have my doctorate and a board certified behavior analyst at the doctoral level. And in the last decade or so, my specialty has been in neuro rehab or brain injury recovery. And it's been an absolute fascinating journey, and it keeps me excited and just as resilient to come into the office every day, despite all the differences that may come about. So Diann and I I was fortunate to have been invited, and I got to kind of see her do her thing and see her behind the scenes at one of the conferences a couple months ago, and we got to talking, and part of my foray into where we are today was presenting brain injury and behavior challenges. And so the work that I do, I work with a multidisciplinary team. We are a post-acute rehabilitation center, and we've got several locations across California and Texas. And we've been operating for about 40 plus years. And what we do really from a behavior department or a behavior programming perspective within brain injuries is basically if something needs to be fixed, we fix it. Whether it's having our patients participate in therapy, providing our families and our staff with the tools to be able to get their goals accomplished, right? We have our physical therapists who are typically trying to strengthen and condition our patients back to what their appropriate mobility will be. And sometimes that's pretty challenging. Sometimes it's difficult, especially after a severe brain injury, whether it's a traumatic accident or a catastrophic stroke. Everyone's response to that brain injury is going to be so different. And there's a saying in brain injury that if you've seen one, you've seen one. Two people can be in the exact same car accident and have completely different outcomes and prognoses. And that's been one of the most exciting educational experiences being in the neuro rehab world, is getting to see all the complicated profiles and really finding the challenge in each of them to be able to contribute to improving their quality of life post-injury.
I find that so fascinating because you're right. Everybody heals differently. I didn't say anything on the last podcast, but my father had a catastrophic stroke and didn't survive it. Although he lived, he lived, but he never recovered.
Yeah.
And so, it was fascinating to hear the story last episode because, she did. And I was so happy for her and her family. So a question for you. Leslie and I, if you may have heard from our podcast, we're married, and we both have had situations with our children, and our spouses and we do not necessarily respond to things exactly the same. And so there's a certain level of resilience for some and not for others. Like the gal with the stroke, Jennifer, you know, she was very resilient and made it through, and my father unfortunately wasn't. So can you tell us a little bit about why somebody is more resilient than another?
Yes, absolutely. What a great question. Because it really gets me excited, especially from a behavior standpoint. And you were absolutely right in the introduction. It is such a universal experience. It's such a universal concept. Each person is going to have their own particular experiences. And what I want to share with you is this behavior analytic view of how behaviors happen, why certain behaviors continue to happen, or maybe we don't see as much, and how that will affect someone's recovery, for example, within the neuro rehab world, or their ability to recover, right? With your different stories, both of you, and your different experiences. And so I say that because one of the what I think is one of the most advantageous views of this behavior analytic approach is appreciating environmental influences. Each person, again, has their own particular experience and perception of what's going on in the world. And something I learned way early on in my academic upbringing was that even individuals or even twins, right, in the same womb and who come out, they still have very different experiences, despite the fact that they are both in the same environment for 9 or so months. They're still going to react and respond in different ways to whatever stimulus or whatever environmental changes are happening. And that's such a unique view. And I think the sooner we start to appreciate that, sometimes it's a little more liberating, because then it makes you realize that it truly is an amalgamation of everything that's going on, right? And so you both shared that your coping strategies and how you perceived and explained and responded to these fairly challenging situations were so different, and that's okay. It doesn't mean one way is right and the other is wrong. It doesn't mean one is more superior to the other. It really just gives you an appreciation for what it is that people are responding to. And so to get into the more scientific and the nerdy part about this is that each person's what we call like a history of reinforcement. So what you've been exposed to, what is rewarding for you, what is punitive for you, is dynamic. It changes over time, right? So
Yeah.
something that might be a little bit easier to compare to is when you were younger, you had a variety and maybe more exciting and more obvious consequences that typically would help you boost better behaviors, right? So for example, some young children, they'll do anything and everything for a lick of a lollipop, or for mom's clapping and grandma's hugs, right? And so those types of rewarding experiences contribute to a person's ability to now interact with their environment, what they find more reinforcing or more rewarding than others. And that's how you start to accrue different sets of behaviors. Now, where it might differ as adults is as we progress and as we get older and as we start interacting, we have more complex skills in the form of our verbal behavior. And what I would try to compare it to is some individuals have a very devout practice of praying, of religious habits. Some individuals may not. Some individuals may also be very, very much into positive affirmation, and using positive words to script things in their lives or to maybe establish rules. And that type of approach, when we start to look at the things we say and how we construct our world with our verbal behavior, with our responses, can make a huge difference as well in someone's behavior, but also in terms of resilience, right? In terms of how much they continue to behave to get some positive outcome in spite of meeting difficulties and challenges. So that's sort of my overview to answer your question.
Okay.
I love, oh, you go, Diann. I'm like ready to.
Yeah, me too. Well, one of the things you mentioned was twins being the same, and I am a twin. And so it is very interesting to see how we handle things. And oddly enough, I think we handle them very, very similarly.
Yeah.
Which is great, because when we communicate, we're on the same page. But the question I have is, you mentioned, faith and positive affirmation and those type of things. Do we find people who have faith and do these positive reinforcements, do they have a tendency to be able to be more resilient than those that don't have a ritual?
There may be some truth to that, particularly because when we started to get into the, again, the behavioral concept, right? What I mean by that is, what are the behaviors that you see that makes you say that person is resilient? And you might recognize there are certain activities or challenges or difficulties, right, that are present in their lives. But what are those specific behaviors? They're still showing up to work. They're still interacting. They're still taking phone calls. They're still getting dressed and getting showered and going to the grocery store. So when we start to break it down into what are the behaviors that people engage in that we start to see and label as, oh, this person is being resilient. That's how I start to analyze that question. And because of that, individuals who, again, have extensive histories of praying or who engage in those types of religious practices, that's become more habitual, right? And it almost becomes just part and ingrained into their everyday behaviors. And it sort of becomes this constant that they're going to engage in this. And at some point along the way, when they start to see things turn, or when maybe more positive outcomes are starting to be recognized, right? There's a tendency now to attribute that, it's because I had the faith, it's because I believed, it's because I prayed. And it's fantastic, and it's so fascinating to see the various levels, right, of prayer and faith and resilience from that aspect. So I think there's some truth to what you're saying there.
Leslie, what would you ask?
Yeah, I think there's a few things that I'm hearing you say. With the faith component, I mean, I do notice that a couple of our guests, that has been a key. For me, it was a key to getting through my daughter's thing, but her faith was, she kind of turned away from her faith, but she did other things that kind of helped her through her recovery. But I think with the faith component, there is that tag to it that there's hope. And I think when people feel hopeless, they need something to grab onto, and whether it's like a support system or faith or whatever it is. But I know when people are practicing a certain faith, they're putting their hope in something that's bigger than themselves. So I see that, and that I definitely needed that. But the positive affirmations, I loved what you were saying with that, because I love positive statements. I have a few that I quote in my head all the time. I like to have them on, just recording over and over in my mind. But I do find that when I have my challenges, that I do let myself have a pity party. So I do let myself feel my emotions. I let the anger be, I let the sadness, the depression, the things that are big emotions, sit with me for a minute, but I do always hold myself accountable to pull out of it. And one of my statements I always say is, I can do hard things, knowing that I've already done hard things I can do more hard things, like I'm capable of it, like I have the ability, and trusting my ability in that. But that's only because I've had experiences that put me in a place that make me know I can do hard things.
Exactly.
So yeah.
Exactly. I love it. And you really speak about a fundamental concept, right? Is that you contacted those positive outcomes to be able to still say these positive affirmations. And that's, I think, one of the defining features between individuals who maybe have more behaviors that we classify as resilient versus those that maybe don't, because you have to have contacted some positive outcome, some sort of reinforcement, however you define it, to be able to continue saying those affirmations, to be able to continue living, behaving, showing up, doing your daily thing. And so I really like that you shared that.
And even Jennifer, our last guest, talked about, having to learn to do everything all over again. And I think her big thing was this swallow test that she just couldn't seem to overcome. And the day that she passed it, like that was a big deal for her. And it was like maybe the thing that kept her onto the next thing that she was going to have to succeed at. And I know like people that deal with mental health issues, that there's a challenge, and Diann and I are going to do an episode where we kind of just talk about the feedback we've received and whatnot. But I know that there's people that have had loved ones, actually commit suicide, and it's like, well, what got them there versus the person that overcame those thoughts, and I think it's just so complex. And like you said, there's not just one thing that gets us to that place. But like for my daughter, I remember her thing was, well, that's not an option. That's not an option. But that was a tool that the expert that was treating her gave her to focus on. And even if it was her, being depressed so horribly that she just wanted to be in bed, my one win for the day was I got her out of bed to take a shower. And it was like, that was it. That's all I needed for that one day, that one little, we call them sparkles and barkles. Yeah. Like that was our one sparkle of the day. And that was all I needed. That got me through to the next day. And so I think when we talk about resiliency, looking at it from a perspective of today is a good day. Okay, well, yes, I don't know what tomorrow is going to be like. I can't start thinking about tomorrow. And we do have, I don't know, Diann and I have talked about it, but like for me, watching my daughter recover from mental illness and, still deals with it, on occasion, waiting for the other shoe to drop, like, okay, it can't be this good for this long. So how do you tie that into resiliency and being able to move forward when you have this fear in place? Like, what if I have another stroke? What if my child gets sick again? Or what if, what if I don't succeed? Yes.
I think people have dread for various reasons. How does somebody work with that? They just have this anticipation that something might be happening. How do we keep that in check? And how do we be a little bit more resilient?
Oh, yeah, that's a fantastic question. I hope to answer that question with something I want to share. So part of what I have to do as a behavior analyst in neuro rehab is I do have to find those small goals, right? I have to find the small successes. And I really enjoyed that Jennifer shared her story in your previous episode, with all those different tests and what she found was her reward, or the big sparkle. And to speak to what Leslie shared, right? The little sparkles are sometimes more important because those are the little moments, the little reinforcers, the little rewards that are going to reinforce and persist and to allow these behaviors to keep happening, particularly behaviors that we start to classify as these are the traits that lead to resilience. So within our setting, in a neuro rehab post-acute setting, there's a slew of assessments and batteries and tests that a patient may have to go through. And it can be very daunting, overwhelming, and sometimes a little discouraging because our job is really to find what is wrong. And unfortunately, after an injury, there can be many things right? Whether it's deconditioning because you've been in a hospital for weeks on end and now you need help from your loved one or a caregiver to just go to the bathroom, right? These things that we sometimes take for granted. Someone was sharing with me that, they got to snooze a couple times in the morning, and that's sometimes such a luxury to be able to wake up on your own and be able to dictate when you can get up and when you get out of bed and when you start your day. And sometimes for our patients, just getting out of bed is a huge effortful activity, whether it's because of physiological effects, you have paralysis or paresis or weakness on one side of your body. So physically, it really is effortful just to sit up, to roll out of bed. From a psychological and mental psychosocial aspect, some of our patients have lost employment, have lost the ability to financially be independent and to support their families. And for some individuals, right, their career is everything. We've had individuals who were CEOs and top execs, and you take away those behaviors, right? It's almost like postpartum. You don't engage in these behaviors anymore. And so it's like, who are you? What do you have to live for? What's your life about? And now you have to have a caregiver be in the restroom with you to ensure that you don't fall or you don't hurt yourself or that you're being safe. And so there's so many things that get to happen after or in the initial stages of brain injury recovery. And it is very overwhelming and it is extremely challenging to have someone tell you what to do, how to do it, when to do it, why you have to do it. And for individuals who are also cognitively impaired, which means they may have trouble remembering what day it is, where they're at, why they're even in our clinic to begin with, right? It becomes so disorienting. It becomes very overwhelming. And so as a result, we sometimes see a tendency for problematic behaviors to happen, right? We might say this looks like irritability. Someone's just shooing you off. Maybe they yell, they raise their voice. Or you could see the opposite, right? Where there's fewer behaviors, meaning they withdraw, they pull away, they don't respond when they're asked or greeted, how are you, good morning, right? And so you start to see this spectrum of behaviors. And what we have to do within the behavior programming department is to provide our staff and our families and really anyone who interacts with our patients, from our bus drivers to our receptionists to our maintenance team, we provide them with tools on how to interact so that we can support when adaptive pro-social behaviors occur, greeting, starting their routine, following their routine, and how to respond when maybe difficult behaviors happen, yelling, refusing, withdrawing. And one of the critical things that we have to do as a team is to identify these stepping stones, right? It's a shaping procedure that we're not just going to get this person to be totally in love with the fact that they had a stroke and they're here and they get to do all these therapies, because a spoiler alert is no one really wants to be in rehab. It's hard. It's difficult, and especially in being away from your family, being away from the environment and the setting that you are comfortable being in. That's very, very difficult. And so our job is to really try to provide those supports. And how do you do it, right? In small steps. And it was great. I love, Leslie, your example. It was so great to hear that, because sometimes we don't recognize what that small success is. We think that, well, you should get out of bed and take a shower. Well, you should be brushing your hair, or you should be going out and socializing. But for each person, they're going to be at a very different, what we call baseline, right? Their typical routine. I have a very different baseline, even compared to my partner, compared to you ladies. And for our patients after an injury, they're also going to be operating quite differently. One individual may have language abilities to interact, to communicate wants and needs. Another individual's baseline may allow them to be able to walk around and physically interact with their environment, while another person may not. They may be limited to a wheelchair and be physically and motorically dependent on staff and caregivers. And so for us as a team, we have to individualize all these approaches, all these programming, to be able to support what is currently in this person's skill set, to enhance what's in this person's skill set, even if it's, instead of saying, hi, how are you? Good morning. It's so nice to see you. Even if it's a wave, we'll start there. We'll take it, right? And we really highlight, wow, we saw him wave. And we're such cheerleaders. We make big deals out of some of the smallest things. And that is in itself a skill, because you have to be a constant cheerleader and find the positive. And I think those, professionally, that's what's required of us. But when you step out of this professional arena and it's in your day-to-day life with families, right? And there's so much more complications and complex dynamic histories with families and friends and things outside of a professional arena. That's where sometimes we might lose sight of the importance, again, of highlighting those small successes.
So if somebody is listening to this and they're going through a challenge, it could be brain injury, it could be a difficult marriage, it could be any life challenge. Let's just take any life challenge. And they're saying, I just don't know how to be resilient. What advice would you give to a person like that just thinks there's no hope, I just can't go on, I'm just, this is the way life's always going to be for me, and maybe their glass is half empty? What advice could you give, or can you give?
Yeah, I'm very fortunate that I get to work with some wonderful professionals, and I learn a lot from them. And our disciplines complement each other in being that voice for some of the patients who do present that way, right? Just because of some of the factors I shared. And one of the, I think, most overlooked, and I'm going to say it's a very simple answer sometimes, is you just have to behave, whether it's just getting up and going for that 20-second walk, whether it's pressing a text message response. It's just starting to behave and to activate. And I like that. I like to share that because it's practical. It is much more difficult to try to convince someone from a mental and psychological perspective to see things the way I see things. I mean, I think even I can't speak for you both, but sometimes even with my partner, I'm like, well, it should be like this because this is how I see it. And I have to be compassionate and understand that that's just my perspective. And if I'm going to get someone else to change their behavior and to see things the way I see things, that one, I have to understand that's going to be a longer road, because that person's experience, again, is going to be completely different from mine. And I have to recognize that they're going to be operating, again, from a very different baseline. So the answer I have is you start small, and behavior activation is one of the proven methods and evidence-based strategies for major depressive disorder. And the premise is really, you just do. Right, similar to Nike's slogan, just do it. Yeah, exactly, you got it. Yeah. Where you're just starting off small and identifying and really having again a support system or someone that maybe you can have by you to recognize those little successes. I think individuals, and I think from what I gather in your experiences and for your children, right, that I think that was their great fortune, and the advantage is that they had families and mothers who had to see it that way, or who emphasized those smaller sparkles. And I think that's such an overlooked and oversimplified, or excuse me, an overlooked and underrated tool, because as human beings, you know, we're so impatient. We expect this right now, right here. And we fail to recognize that after an injury or a trauma or a devastating situation, that is a shaping process, that we can't necessarily bounce back to how we were right before the event. And that's something that we really try to encourage our families or our patients. And I even try to do it in my personal life, right? Is that I'm not going to be Anneka, who I was in 2019 and on April 21st. I'm Anneka 2.0 today, and then I'll be 3.0 tomorrow and 4.0 and so on and so forth. And I think that gives you also some flexibility and some hope that, you know, each new day is just going to bring about a different set of experiences. And I think as long as you recognize that and you just do, that's the way to build some momentum.
I think that's some outstanding advice, because we all think we can be that person we were. We, you know, whether it's the amount of weight that we were able to lift, or distance that we can walk, or, you know, the ability to sit at a desk and work. You know, we all think that we should be the person we were when we were at our prime, and that we should never have anything deteriorate from that. But I think it's a good lesson to hear. And thank you for sharing that, because it might be something that I struggle with, because you know, I always think I should be at the top of my game. So thank you for sharing that.
Yeah.
And I think sometimes we do, you know, we do lose sight of that. Like but it goes back to what you were saying at the beginning, like how the way we behave is based on our experiences. And so, yeah, well, I experienced that 30-year-old bod that I had back then, and I'm 50 now. So I want to experience that again. But I've also had all these other experiences that have given me much more head knowledge than I did at my in my 30s.
Right.
But, you know, so we see people behave and respond, and it ties to resiliency, as you indicated, through based on experiences. How much does, I kind of want to, how much does personality play into it? Because haven't we all met those people that, like, Eeyore is their spirit animal? Like, you're back on, you're just like, oh my gosh, like, come on, I want it more than you do. How do I help you want it as much as I want it for you? So is personality a part of that, or what is that part of it?
Yeah, I'm so glad you said something about spirit animals, because you ever find that your spirit animal also changes?
Yes, absolutely. Depending on the
Right.
day.
Yeah, exactly. Right. I was about to say, for the weekend, you know, I want my spirit animal to be a sloth, and then sometimes I could be a, you know, crazy tiger, just like pouncing through and bulldozing everything. So to answer your question, I'm also going to liken it that way. It's looking at, again, what are those behaviors, right, that contribute to someone being a type A. Or I think I shared with Diann, she said, describe yourself to me. And I said, well, I think I'm a recovering control freak.
That's one of my things I say as well. And I think Diann's the same. I think
Yeah.
we're all in different levels of recovery.
Yes, exactly.
We're all in good company. But why do I say that, right? If someone was saying, you know, oh yeah, that's her personality, it's because there's certain behaviors that I do that would contribute to that label of being a control freak, or a type A, or, you know, whatever the label might be. And we have to account that absolutely those behaviors, however small, pervasive, consistent they were, right, that describe your personality, definitely play a role in your future experiences, how you respond to things. And the power of spoken word, and how that correlates to behavior is so instrumental. Because if I had someone who I valued very much, right, a person in my life that I looked up to and I found as a mentor, or that I thought very highly of, and they started to describe me using particular words, I'm going to behave in a manner that might either match that, or that might continue to reinforce this idea that I am those words. And that's where we start to see more extensive behaviors, or what we say personality traits, persist. And it absolutely plays a role, because then we can identify what's more probable for a person to do, right? So if, for the way I operate, if I've now described myself as a control freak and type A, and I have lists on lists, and if I turned my camera around, you're going to see.
Oh, this is my book of lists. I have a book of lists. You can't see it that well, but yes.
I love it. I love it. And so I'm in good company, it seems. So because of that, when I'm going to, because that's part of my personality, my traits now, these small behaviors that I engage in, the next time I'm faced with something fairly challenging or exciting, i.e. being invited to this podcast, I've created a little list for myself. So now this is part of my personal routine, the behaviors I engage in. And I know that now moving forward, or maybe it's safe to say that moving forward, when I'm facing these different situations, however exciting, however daunting, however difficult, that part of my personality is to attack it from a more objective and a task organized way. And I, in my experience, have found that behavior, those behaviors, to be rewarding, to be supportive of what my goals are, or what I need to do. And I think I heard it somewhere, right? But the adage is, that which gets rewarded gets repeated. And it doesn't matter if what is being repeated is drug use, substance use, list writing, laughing, engaging in social activities. That concept, of that principle of reinforcement, is so universal. And that really speaks again to some of the resilience and why personality traits may continue to persist even after a traumatic event.
Yeah. And sometimes it's okay if an item on the list doesn't get checked off. I've learned that. I've had to come to terms with that and realize one of the things I like to say too is that mostly the only thing I can control is how I respond and react to circumstances, and that which I actually can have hands-on ability to move or make happen. So, it's getting in that mindset and looking at, people that might not have maybe our personality traits, tap into other aspects of their personality traits that help them get through. Like if we are faced with a challenge, that's my first thing. Let me go research it. Let me see what kind of solutions there are. I am a problem solver. So that's my way of doing it. But like what you said earlier, it's not the wrong way or the right way. It's my way, how I deal with it. So I'm sure, with patients that you deal with, that if they're task oriented and list oriented, they're like, okay, give me the list of things I have to pass to break out of this joint,
Yeah, exactly.
Focus on it. They'll focus on it. Whereas some people might have to learn certain things. Maybe they're not familiar with how to do things like that. And maybe they have lack of self-confidence or whatever it might be. I think a lot of times resiliency and being able to have resiliency is like getting to a place of confidence, knowing you're going to make it through. I mean, It's self-esteem, it's confidence, it's personality, it's, past experiences, all these complex things. So what do you have to say about that? Like about confidence and self-esteem and resiliency?
Absolutely. Diann, were you going to say something too before I?
Yeah, I was to say that the way I deal with a usually really stressful situation is, we're going through it. I do what I have to do. I just get into task mode and get it done, but I'm a sleeper. I will sleep during stressful periods. I'll do what I have to do, but in order for me to recover, I need to sleep, and I'll sleep for long periods. But the amazing thing in thinking about all the things that I've been through, I don't understand why I have never had to go through therapy. I would think I am the person that could keep a therapist in a very expensive home for a very long time.
You're
Because
killing
I
me.
have had so much in my life that has happened.
Yeah.
And, you just don't think about that. I was talking to somebody the other day, and my sister says, "Oh, tell him how you were almost kidnapped." I'm like, "Oh, that's right. I was almost kidnapped."
Yeah.
And I have all these things that that have come up in my life, and somehow I'm assuming it's resiliency that has caused me to be able to come through this. I won't say unscathed, but with very little damage. And so I'm just wondering, how does that work? I
Yeah.
mean, I'd like to bottle it so I
Yeah,
can give it to my son and to anybody else that needs it.
absolutely. Okay, so I love these questions because they all tie into one another. And I think to answer your question first, it just goes back to what are those small behaviors that you engage in, right? You said you're task oriented and you just kind of do, and then you sleep it off and you kind of recover and reset, and you give your body some time to regain some homeostasis, which is awesome, because I think those are some things that in part of my readings and in some of my personal interest in trying to read a little bit more into different topics, I'm really fascinated by the relationship between stress and health. And having survived and gone through grad school, there are certain things that I didn't find until 2 years later, 3 years later, that I didn't realize in the moment maybe were unhealthy or had contributed to maybe how I perceive things now. And so to answer your question, it just goes back to one of those smaller behaviors that you engage in that keep you on task. When we start to look at what are the behaviors that people may engage in that lead to poor resilience or poor outcomes of resilience, there's something about how those situations may temporarily stop or freeze or paralyze people from behaving, right? That they start to develop patterns or they create these rules that everything I do is going to be pointless. Everything I do is useless. And now they've created these beliefs, because beliefs start off by rules, by making statements. And I'm such a rule governed person. That's a concept also in behavior analysis and in neuro rehab, right? Is you find the rule in the expectation or in the situation. And we sometimes take that to another level when it comes to our behaviors. So if you create rules for yourself that are productive or destructive, however they look like, that's really going to make an impact on, again, how it is that you get through situation after situation after situation. And there's something to be said about being objective in the moment, creating these mini goals for yourself. It's not so much to bombard you with more things to do, but I think it really speaks to how you can orient yourself and minimize the distraction around a situation, because again, it gets very tempting, I imagine, to start going down that rabbit hole of, and I think one of you asked me earlier, how do you prevent that, waiting for the shoe to drop? It's that living in fear that, this is too good to be true, something's bound to happen. And again, just by echoing those mere statements and saying it in that manner, I'm already prepping and priming myself that, yep, something is going to happen. Oh, and sure enough, there it is, right? Whatever it might be. And you might see it as, oh, it's just, a small detour in the road. But for me, if I'm already creating this anticipation and these rules about, it's been 2 weeks, something's going to happen, it's just bound to happen. Oh, it's too good to be true. I've already set myself up to be more vigilant for the negative than the positive. And I know in some of the readings that I've done, and there's a book I wanted to share a little later, that talks about the importance of, and again, it's just super simple and underrated, but the importance of really emphasizing the positive. And I can share some practical tips for how to do that, right? And the point is not to be Mary Poppins. It's not a how-to on how to be the, cheerleader, but just really practical tips on how to start doing it in your day-to-day.
Well, there's no time like the present.
Yeah, share. We want to know. Give us all the details.
Absolutely.
Yeah. So, one of the, so to piggyback off of our conversation, one of the critical things about looking for the positive is just practicing to verbally say out what is going well, right? I'm so happy that there's no technical glitch so far. I'm so happy I haven't frozen. And just saying it in high frequency and in saying it more consistently, right? That's going to start to prep and prime you to look for those positives. Again, however you see positive, because again, human nature is we're looking for what sticks out. We're looking for what's wrong. We're so quick to find out what's wrong. And unfortunately, I think the way our society operates and how even, in academics, if you're graded on a certain rubric and then you fall in this category and then you can't quite get to this type of institution or scholarship or whatever, right? Sometimes that can set you up for being devastated or to find it too daunting. And so by just really small steps of, wow, this is going great. Oh, wow, I did XYZ today. Wow, I took, one shower. And for individuals who are listening to this and what you may be able to share, if you are a caregiver or if you are in someone's support system, practice that as well, because it's not always easy for the person experiencing it, right? It's a very difficult skill to just start saying because it doesn't feel natural. It might feel awkward. It might even feel weird to say like, well, yeah, of course I'm not having any glitches. But sometimes that does need to be said. So I think first saying, practicing saying those positive comments, no matter how small, no matter how silly they are, it's really about teaching yourself how to get into the habit of it, because that's how habits start, right? Small steps. The second thing, and this speaks a little bit to what I said about behavior activation, is just do. I don't anticipate or expect, even for myself, to, tomorrow be a marathon runner. I do not enjoy running. I do not enjoy cardio. But if I'm able to just do a 10-minute walk around the neighborhood or even a 5-minute walk around my backyard, those are the small steps to activate myself, to just get myself moving and doing. And I'm sure there can be a completely different hour and podcast on the health related benefits, but there was something, and I shared with you an article that I read where physical activity, because of the neurophysiological effects it produces, it presents with what they call this window of plasticity. So it almost makes you more susceptible and it makes you more receivable to behavior interventions, to positive affirmations, to maybe even medication use, to support systems, right? So it's almost like a primer for being able to receive all the fantastic support that there is out there. So my first tip is start with the small, with identifying positives. My second is, just do. Start to walk around, behave, exercise. I think they said, there's so many different articles and findings these days, and the last one I saw was just 1 hour of moderate activity for, 5 days within your week really allows for productive physiological changes that again makes you more receptive to these kinds of interventions.
That's great advice. And I think we all need to remember that if we just sit where we are we're just going to be there for a very long time. We have to get up, be in motion.
Yeah.
That's going to help us change our mindset, the way that we deal with people, the way that we think. And I think maybe that is part of my success, is after I've slept for a long period of time, I do get up, I do something. I don't just lay around and mope. I try to, conquer whatever little bit I can do at that time.
Yeah.
Because, sometimes hard decisions, they can weigh on you for a very, very long time. Unfortunately, I had to make the decision for both of my parents to take, to pull the plug on them. And it was more difficult for my father because my mother was brain dead, but my father had that stroke. And so the choices that we had to do for my dad, lasted 10, 12 days before he passed. And you're experiencing that the whole time.
Yeah.
And then of course my husband's parents also had similar situations. So, you don't take these decisions lightly. And they stick with you for a very long time, but you have to kind of make sure you're doing something so you're not just dwelling on it.
Yeah.
Because ultimately, for me, when I dwell on it, I dwell on the fact that I did what my parents would have wanted and what was best for them in the condition that they were in. And I think sometimes we get squirrely and we think about things further out, a little bit more esoteric. And it's just like, we can't do that. We have to remember what we did was for someone when it's that type of situation.
Exactly. Absolutely.
Very interesting. I was thinking about just like what you were saying, Diann, just that ability to just get up and make, like active motion. So I have a tattoo on my foot from around the time that I was getting over the other side of my daughter's challenges, and it just says forward, and it's an arrow.
Yeah.
And that's like my, reminder, just keep, even if it's hard, but sometimes, that first step is the hardest. And once you're able to kind of push through it. And I think we all have the ability to do that. It's just believing in yourself that you do have the ability to do it. And it might take longer than you want it to take. It might not be as perfect as you want it, but whatever the challenge is, if you just kind of make that forward motion, you're closer to your goal than not moving at all. Is the way I like to put it.
Yep. Because, to speak to both of you, what you've shared, it's really about building incremental tolerance, right? So Diann, when I'm thinking about how you described your work ethic and your routine, you basically conditioned and trained your body to do, and you get your task list done, but then you allow, from a physiological standpoint, time to rest, because that's typically right where the teeter-totter is with what they call bad stress or toxic stress, if you don't provide yourself that time to recover. And from a behavior standpoint, you're providing yourself opportunities to persist, to continue, to build endurance, but also giving yourself, right, a little break, a little reinforcer to prepare for the next set of steps and to prepare for that next trajectory of tolerance. And it's really similar to our patients, where each day is going to bring new challenges, and not everybody is going to be again on the same page. Different baseline levels. You're going to feel great on Monday and then feel completely exhausted by Tuesday. And what we can only provide is this enriched environment of support, of positive reinforcement, of consistency, so that when they are experiencing distress or feeling overwhelmed or maybe even unmotivated, right, that the supports are still there, that we're still going to encourage. We might lower our expectations. Maybe we're not going to do 20 minutes on the treadmill. Maybe it might be 5, but you still did something. And now you're building your endurance, your behavioral endurance, and your behavioral tolerance, which ultimately we start to classify as being resilient.
Very interesting. The other thing I will say I think is helpful for me is I allow myself that moment to mourn. you know, and it could be ugly. Oh, it could be loud. It could be so ugly. But I don't stop that process. You know, a lot of people want to hold it in and keep it. But I remember I cleared a room out when my mother died, you know, with wailing.
Yeah.
I think we forget that. It's so important.
Absolutely. Absolutely. And you both shared that, right? So that's a common experience that you both have had, where you just have to experience and you feel, but you both have also demonstrated and almost become accustomed to certain behaviors where you don't get stuck there, right? That didn't stall you from moving on to the next thing or the next day, or that experience alone didn't again stall you from continuing to live and being able to see what you get to see now.
I think just the opposite. I think I was able to release it.
Yeah.
So by releasing it, I then could step forward. I feel bad for the people in the waiting room. You know, I feel bad. I'm sure they'll never forget that crazy lady in the hospital. But you know, I was able to release it. And I think that's really important. I think people try to hold things in for so long. And we are of the generation where we put things in a closet and we hide it there. And I don't think we should. I think we need to open up the doors and air it out and allow ourselves to breathe.
Yeah. Well, and it's just it's our truth. It's honesty, right? Emotions are honest. Emotions don't really lie. Emotions are what is happening internally. And so when you're able to be honest with your feelings and your emotions, and, you know, a lot of times I do that in solitude. Nobody else is seeing it. You know, it's me dealing with it and working through it. And then, allowing that release, as you mentioned, Diann, you know, just getting it out there so that I could then move forward. Because if I keep it down and mushed inside, I'm going to stay stuck. Oh, yeah. And I think that's, you know, a common thing that I see people who are stuck wherever they are. You know, I have, you know, friends that are stuck and not being happy with their job or whatever. It's like, okay, but you've got to release like this stuff to be able to move forward, because otherwise you're just going to wallow in it. And we should be given permission to wallow in it for a moment, but be able to then release it in its most honest, purest form so that we can move forward. And I know that for me, that like you're saying, Diann, it's just, it can be ugly, but it's my truth. True, it's honest, you know, and it helps me to then not be bogged down by the emotions of it and move forward and get to the task on hand, which is improving whatever the situation is in what I have control of.
Well, I think we're getting close to the end. Anneka, is there something you would like to wrap this up with?
I am so appreciative of the space to be able to share this. As you can tell, I'm very excited by this topic, and particularly as it relates to our brain injury and behavior and just behavior in general. But I think maybe my closing comments will be that I think each of us is going to experience things differently, different situations based on our upbringing, our culture, the rules and the beliefs that we have set for ourselves, and to be compassionate to ourselves as well, right? To recognize that it's a fluid process, that you are Diann Friday, April 21st, and you're Leslie Friday, April 21st, and you're going to be different tomorrow in various respects, and that's okay. And finding, that cathartic release, but that it doesn't stall you and it doesn't become this ceiling for future growth and progress. And finding those small sparkles. I like anything sparkly. So finding those small successes, right? That's going to help you to build your behavioral endurance, to build your resilience. Because ultimately, we've got one life to live, and putting yourself in situations where you're creating negative scripts and you're creating, there's already so much scariness and negativity out in the world. And so if you create for yourself a positive environment, you know, that's the best that you can do for yourself. And it's probably the most compassionate thing you can do for yourself.
Absolutely.
Well, do you want to do your closing comments, Diann, and then I'll
Yeah,
end
I
with
think,
my usual.
yeah, absolutely. That'd be great. So we are so delighted that all of you were able to join us today. We would love if you left a comment for Leslie and I to let us know how we're doing. If you have any speakers that you would like us or topics that you would like us to cover, please let us know, because we really want this program to be your program, to all of those of you that are listening. And I do hope that all of you become as resilient as possible. Let's truly try hard to be on the positive side, to remember all the things that Anneka told us, you know, those positive messages that we help and we tell ourselves really makes us a half full person. And I think that really is an important thing when we're talking about resilience. And when we're with those that aren't so resilient, let's remember to just give them a break and see if we can give them a helping hand up, because whatever they're going through is really hard for them, and we just need to provide them with a little bit of understanding. Leslie?
Thank you so much. And thank you, Anneka, for sharing your expertise. I learned a lot today. And I think it's very universal in whatever challenges people are facing. And I am so thankful, you know, that we have these resources available. I hope today, even if just one person was able to gain something from this episode, it makes my heart super happy. I love positivity. If you know me in person, I'm like that person. Some people say I'm a little too hippy dippy, but I don't care. I'm going to be that way because that is what has allowed me to be resilient. So with that being said, until next time, remember to be kind to yourself, be kind to others, and sprinkle it everywhere like glitter so we can be sparkly. Thank you so much, and we'll see you next time.